About 12 years ago, as they first initially put a clinic here. It was at the Social Security office. It was only open part-time. It was only open 2 days a week. And then about 10 years ago, they moved to a full-time clinic, 5 days a week. And then
that was on Lake Avenue.
No, it was still at the Social Security office,
okay.
and we outgrew that. And then approximately 9 years ago, we moved down to Lake Avenue. And then here this past November, we moved to this site.
So you saw a definite need for expanded service area?
That is correct.
Yeah, with the Erie VA Medical Center, we have 5 community-based outpatient clinics, and Ashtabula has one of the highest veteran populations in those rural communities that we serve. So, I mean, I think there was definitely a need. You guys have been growing and expanding at the Ashtabula Community-Based Outpatient Clinic, or CBOC, as we like to say. So that's definitely been a need. And all the programs that they've really been expanding to, everything from behavioral health services to some telehealth services, just really drew in more and more veterans. And with all those clinics that we're expanding, I mean, there's definitely a need to grow the space that we had here.
One thing I've heard a little bit is that this place is so busy that if you call for an appointment, it's like June or something. Is that being addressed?
Yes, that is.
Yeah, absolutely. And that's a good question. Something that we really try and focus on at the VA is having that open access. Now at the Ashtabula Clinic, we had a few changes of providers, which left a little bit of a gap in time. And since then, though, we've had additional hires, which really helps the patients, benefits them, so they are able to get in within a timely manner. Absolutely.
Yes.
So what services do you provide here versus what you may have to go to the big hospital in Erie for?
We are set up mostly as a outpatient doctor's office style setting, but we do offer phlebotomy, blood draws here. We do have telehealth, where a patient would not have to go to or travel to Cleveland or Pittsburgh to see, say, a cardiologist or another subspecialty. We can do that via video conferencing. Now, if you needed diagnostic, especially diagnostic testing, say radiology, x-rays, or an ultrasound such as that, that would have to be provided at our Erie facility. This is our laboratory setting. This is where we perform lab draws or phlebotomy, which is ordered by the physicians here. We send our samples up via certified courier up to the Erie VA twice a day, and they process all the lab work and return it via our computerized patient system, our information system, to the providers. We average in the lab probably daily 30 to 40.
Wow.
The providers are scheduled on average 12 to 14 patients daily. We also have 2 providers here. We have a nurse practitioner and we have a physician. We also have a scheduled nurses clinic for patients to come in to be seen for blood pressure checks, wellness checks, dressing changes, wound assessment. We also have a nurses clinic to provide diabetic teaching, glucometer teaching, such as that. We also have an unscheduled nurses clinic where a patient could walk in and say, hey, I'm having a cold, or some cold symptoms, or, hey, I bumped my arm, the swelling hasn't gone down. I just like to have somebody look at it. And we do a triage and we assess them for that. And if the RN feels that they needed to be seen in an immediate manner, we go and talk with their assigned providers and present the case to them and get their orders, either to be seen here or possibly need to be seen up to the urgent care up in Erie for further and higher level testing. Yes, each of our community-based clinics, our CBOCs, has what they call an HBPC, which is a home-based primary care nurse. She has 30 to 35 patients assigned to her panel that she goes out and makes appointments with and visits. It may be something whereas the patient's not physically able to come in here and needs to just a little bit of extra care. It may be lab draws, blood draws, or it may be something as simple as setting up their medications for them for the next month. Aids in their compliance and keeps them well to where they do not have to be seen in the clinic. This is one of our exam rooms, and with this new facility we have the room to actually implement what they call PACT, which is patient-centered care. This is where the patient is the center of the care provided to them. We bring the patient into this room and we all come to them for vital signs, the provider to examine them. Any services that they may need, say an EKG, is brought to the patient. The patient is actually the director of their care. We're here to provide services and alternatives for them, and they ultimately make the decisions.
All right, so one of the other big initiatives for the VA Medical Center has really been focusing on providing the best health care to women veterans. A lot of people still see the VA as your grandfather's VA, but we're not anymore. In fact, women veterans are one of the fastest growing veteran populations that we have, even in the military. That's just a huge rising population right now. So in response to that, and proactively too, we want to be able to provide women-specific, gender-specific health care to our nation's heroes, to our women veterans who return as well. So any viewers who are watching this, if you are a woman who has served in the military, we really encourage them to connect with the VA, see if they're eligible and enroll for health care. Something unique about women veterans, they don't always self-identify themselves as a veteran. So that's one of the hardest things that we're finding when we're reaching out to the community, is women who have served in the military don't identify themselves as a veteran. So they never even think that they could be eligible for VA health care. So that's one of our focuses that we're moving forward. And at the Ashtabula Clinic here too, the new clinic provides a bigger emphasis on women's health with 2 dedicated rooms right next to each other.
This is part of our telehealth initiative in the clinics. This piece of equipment here is what they call a teleretinal imager. Anybody with diabetes should have an eye exam once a year, and the VA has instituted, instead of the patients having to travel the distance to the VA, the main VA at the Erie VA, the telehealth tech can actually take digital photographs of the patient's retina, the back of their eye, and send that up to the eye physicians up at the Erie VA, and they can review them and do their examination that way instead of the patient having to travel.
So it's technology also plays a big role in all of this.
Very much so. Another big thing here for us is the teledermatology. The wait time for an outpatient appointment used to be 2 to 3 months. With the teledermatology, the patient can be in seeing their provider at a regular scheduled visit and say, I'd like to have this bump on my arm checked, or this rash, has been going on, I can't get rid of it. And the provider can order a consult for teledermatology. The technician is able to take those photographs of the area and digitally transmit that to the dermatologist that's assigned to our clinic, and we can have the results and his recommendations for treatment back within usually 24 to 48 hours.
And that all relates to the whole patient-centered care idea too. It's better, faster results for the veterans that we serve.
When this whole place was built, was that in mind, like lots of areas for internet access and computer terminals and all that sort of thing?
Computer-based patient records is very supportive of this. We can just keep adding on to this, and that's one of the big support structures that allows us to do this. The digitalization of imaging and such, we can just send everything right over secure connections and have them seen that way instead of having to physically travel to, say, Pittsburgh to see a dermatologist.
That's really the future of healthcare, where we're really moving, that we're pouring resources into, because it's providing the veterans with the right care at the right time in the right place.
We have actually 3 rooms dedicated to the telehealth. This room here, we have one next door for private sessions for patients, say if they need one-on-one counseling, say with a behavioral health specialist. That is next door, it's a VTEL. And then our group room, our meeting room, which is in use right now, we do group educational sessions for patients for, say, weight loss, for dietitian education for them, instead of having to go to Erie.
So, in all this, they're speaking to somebody via the computer, like a Skype type of thing?
Exactly. It's all real time. And these 3 rooms here at the end of this hall are for our behavioral health counselors. We have a nurse practitioner and 2 counselors, social workers that also work here at our clinic, addressing the behavioral health issues and needs for our patients.
Okay, now how does that differ from what you were talking about, the like Skype type things?
If the patient needs to be seen or evaluated, say, by a psychologist or a psychiatrist, they would not have to travel to Erie. We can do that over our VTEL or Skype-like interface with the Erie VA, with the Behavioral Health Center up there.
We're very excited here at the Ashtabula Community Clinic. We're actually hosting an open house where veterans and their families are invited to stop in on Wednesday, April 8th from 3 to 5 to meet with the VA staff, learn about the different services and programs that they have available here, and even take tours of the new clinic. Again, this new clinic opened this past November, so now that the snow has melted, temperatures are a little bit warmer, this is perfect time to come out, and if you haven't visited the Ashtabula CBOC, to please come on out. For any veterans too who have never enrolled in VA healthcare, this is a perfect opportunity to view what you've been missing. We have so many programs, so many services again available for them. So veterans are encouraged to come on out and just learn about what resources are there for them.